Hello, everyone. Everyone's just starting to join, so we'll just give it a minute and then we'll get started. Great. So why don't we get going? Thank you, everyone, for joining us this afternoon, this evening. We appreciate you being here, and welcome to the Ampere Social Media webinar. My name is Kelly Raymore, and on behalf of the advocacy team at Immunovant, I'd like to welcome you all tonight. We appreciate you being here. And wanted to give a really special shout out and a big thank you to our partner this evening for working with us on this webinar, the MGFA. We really appreciate your partnership and all that you do to support the MG community. So thank you so much for partnering with us tonight. Just quickly, wanted to introduce Immunovant for people who might not be familiar. Immunovant is a clinical stage immunology company focused on enabling normal lives for people living with autoimmune diseases. And about 3 years ago or so now, Immunovant began what has become known as the AIM program, which is the program that we'll be delivering tonight. AIM stands for Advocacy in Motion, and it has been designed as a skills building program for US-based patient advocates. And over the last few years, we've been lucky enough to partner with MGFA on a variety of different AIM programs on a host of different topics, from understanding clinical research to facilitating effective support groups. And so some of you who are on the line tonight may have attended some of those, so thank you. Today's AIM program is going to be focused on social media. And the reason for this is, as you all know, we're heading into MG Awareness Month. It's right around the corner as we enter June, and social media is just one really great way to spread MG awareness. So today's discussion is going to talk about some tips that we hope you'll take with you as you think about using your own social media channels to talk about MG and spread awareness during the month of June. And we are also going to touch a little bit on some ways, both in social and beyond, that you can take action with MGFA next month to spread awareness as well. So just really quickly, before I introduce Mike, today's speaker, I wanted to just review a few housekeeping items. Please know that today's session is being recorded. We also want today to be an interactive discussion. So there's some places that we will ask for your thoughts. And so we would love for you to participate in the chat as you feel comfortable. We'll also have a poll. So we'd love for you to participate in that, again, as you feel comfortable. And then if you have any questions, please just drop them into the Q&A function throughout the event. And we are saving time at the end to get to as many questions as we can. And so with that, I'd like to introduce you to my friend, Mike Matthews. He is a social media marketing professional, and he's the director of social media at Bright Dart, which is a healthcare communications agency. Over his career, Mike has worked with a lot of different corporations, big and small, healthcare companies like Pfizer to consumer companies like Marriott. He's also an adjunct instructor of social marketing at NYU and Fordham. He personally has a very active social media presence. And in fact, he has a sweet story that he'll tell in just a little bit about helping his grandmother become a social media influencer when she was in her 90s. So you'll get to hear that in just a few minutes. But with that, Mike, I'd love for you to just take it away.
All right. Thank you, Kelly. Hello, everyone. I can't see any of you, so I hope you're comfortable. Hope you're having a lovely evening. I'm in New York City, so it might be later than most for you, but I have a golden doodle that's sitting here looking at me. I have 3 bones, just in case she interrupts us. My daughter's at rock climbing, and my wife is a nurse at the hospital, and she has to visit the evening crew. So hopefully that doesn't happen, but you all understand what that's like working from home. And yes, I was a clown in the parade. So 7-time, 5-time legally a clown, 2-time I had to sneak. 2 times I had to sneak in. That's a totally different story, but I hope you're proud of me. My mom is, of all the accomplishments I've had. So next year when you watch the parade, just know one of those little silly clowns is me. So it's good to have you guys here. I want to hear from you to kind of kick things off. And like Kelly said, please feel free to use the chat function, the Q&A function there. But I'm going to do a quick poll. But I'm glad we're having this conversation about social media as we head into MG Awareness Month. I just want to point out a couple of things really quick too, before we do the poll. We won't go over tactics and technology today. It's hard to do that within like an hour presentation. We could talk about Instagram stories, for the full hour, or TikTok or something else. And so this is kind of stepping back a little bit from the technology of social media and focusing on the content and what we can and should and what resonates and that kind of thing, and what I've learned and experienced from my professional and personal career. And then hopefully you can find some application on your approach to social media. If you're starting out, if you're beginning with this, or if you're much more advanced and you're used to the tools as well. So just stepping back, so don't worry that we're not getting into the nitty-gritty of the technology today. That's for another kind of probably one-on-one discussion with each of you. So I want to hear a little bit from you, and to kind of see your level of involvement in your primary social media channel. And so I'm going to bring a poll up here in front of your screen here in just a moment. And so the first question I have is, what is your primary social media channel? And so go ahead and vote on that. Wow, you guys are quick. Okay. So far we have 10 people have voted, 11 people have voted. Wow, quite split. This is interesting. Okay, so right now, 38% say Facebook, 23% say Instagram, 15% say TikTok. Maybe I'll just give you just 10 more seconds just to vote on that one. Looks like we have 1 or 2 that just came through. So I'm going to end the poll, and then I can share this with you, the results, so you can see it. Okay. So I'll share the results with you. Hopefully you can see that right now. So it looks like Facebook is the primary, followed by Instagram, LinkedIn, and TikTok. No Twitter users out there, or at least your primary social media channel, I should say. And then LinkedIn as well. Okay, thank you. I have a second question. So thinking about that platform that is your primary. Now, let's answer this question here. 1 sec. Oops. There we go. Sorry. So how do you typically use this channel? You post about your personal life. You're spreading awareness about MG or important issues to you, interacting with content from other people. So less posting and more just kind of perhaps making comments and going back and forth with people on social, or just kind of scrolling to view updates from others. While you do that, I'm going to go with bone number 2 for Lolo. Okay, maybe give you just about maybe 15 more seconds here. Thank you for voting too and making this interactive. This really helps to understand. Wow. So far, a very active group as far as spreading awareness about MG or in important issues as well. Okay, maybe just take 10 more seconds. Okay, I'm gonna close the poll, last chance. Okay, I'll share the results here. Very interesting. So less about your personal life and very much, this is a very active group that I'm talking to. Um, so this will be a really good discussion then. Thank you for sharing, for participating in the poll. That helps me understand who I'm kind of talking to and how you use social. Okay, let me just stop sharing that. All right. So I want to just talk about our focus for today. We're going to talk about three primary topics. Um, First is we'll talk about how to tell your story on social media and in an impactful way. Second, we'll review tips to consider when you're creating content on social. And third, we'll talk through what to do after you capture someone's attention, including how to keep people engaged and how you can engage with other people's content as well. And most importantly, I'm here to answer any questions that you might have. So please share your questions in the chat. We'll get to as many as we can. We'll have time at the end of the discussion today to go through and try and answer as many as I can. I'm kind of navigating the slides as well as the chat a little bit. So if I'm slow to get to it, please forgive me. But so before we get into that, I just want to do a quick review of the platforms. This is helpful to understand that, especially the amount of daily engagement on each of the platforms. For those, it sounds like primarily Facebook is the primary platform for most of you. My clients will always ask me, is Facebook dead? Is it just too old? Is it irrelevant? And I'm like, it is absolutely not. It is still completely relevant. So the largest overall segment of social media users in the US are adults between the ages of 27 to 42, or your millennials, and 30% are Gen Z, which is 25%, and then the 43 to 58-year-olds are 23%. But Facebook still commands 53% of all social media site visits in the US. That's huge. So Facebook is alive and well. Certainly when I think of Facebook and my audience, you kind of -10 to get Instagram, -5 to 7 to get your TikTok audience. That's kind of the best way to think about it. It's worth noting, and it doesn't sound like perhaps like X or Twitter is as relevant for this group today, but last year, almost exactly a year ago, X users were polled in the US, and over 1/4 said that they were unlikely to use the platform a year later, politics and other reasons and things like that. And so we're seeing a little bit of a decrease with that platform right now. And then, of course, the fastest growing platform, also very much in the news, is TikTok. TikTok has a daily engagement of 46 minutes, and it doubles in users every year. That'll slow down, but right now it's still the hottest platform. And I know there's a lot of questions on what's going to happen with TikTok over the next little while. We're watching that very close. LinkedIn, it sounds like primary platform for many of you is LinkedIn. As you've probably noticed with LinkedIn, do you remember using LinkedIn the first couple of years? And it was just, I'm looking for a job or I have a job open. That was the primary function of the platform. And especially we've seen a massive shift over the last 5-6 years of it's become kind of a true professional social network. People are posting more and more about their personal lives and also just things that are happening within the company, professional accomplishments, and just more about them. And that's really kind of shifted quite a bit. So that's been interesting to watch the changes. So the first section today, let me just make sure I'm not missing any in the chat. Oh, thank you. Yeah, let's see here. Nervous to share medical info. Yeah, I understand. Facebook, IG. Yeah, I use TikTok to tell my story. Sorry, I'm just catching up on your comments. Thank you for all that. So telling your story. Let's talk about that real quick. Telling your personal story is a very powerful way to spread awareness and drive social engagement. And I completely understand that it can be very frustrating, especially if you're talking about something as vulnerable as MG. to just put yourself out there and discuss it. Like have you had that experience where you talked about whether it's MG or something that's vulnerable and you put it on social media and the reaction is, I'm hopeful it's positive, but perhaps someone didn't show a lot of empathy, or perhaps there wasn't a lot of reaction to it. That can be really deflating. I mean, that can mentally, from a mental health standpoint, that can hurt too, right? And so I understand and I acknowledge that social media can be a very positive thing, and it can also be a very negative thing too, for us personally, for many reasons. And so these are just platforms. We as humans can decide how we use them and how we interact with content. But so let's just talk about telling our story in an impactful way. I want to do an exercise, and this is where I definitely will be monitoring the chat. So get ready for this. But on your phone, in your head, writing it down with a pen, whatever, can you take a moment and write down 2 or 3 people, organizations, or brands that you like to follow on social media? You like to follow them on Instagram, on Facebook, TikTok. So write those down, and I'll just give you a moment to do that. And once you have those, you can go ahead and put those in the chat or the Q&A function. And I'll have a couple of you share, if that's okay. Oh, I see they're coming in. These are great. As you're doing, take another minute to write down your 2 or 3, or put them in the chat. I'll read a couple from that have come in. Kristen, oops, let's see. Audubon, Run to Change Lives. MGFA from Janelle, Patience Rising. Yolanda, Deepak Chopra, Brene Brown. I have, my wife and I read Brene Brown books constantly. Christian Dragon Boat Life. I don't know what that is, but I'm going to have to look that up. Kathy, MGFA. It's a great shout out. Betty, another MGFA. Replace Your University. I'm not sure what that is. Meredith, regional local companies like coffee shops, restaurants, influencers. Yeah, absolutely. Anyone else have any they'd like to add there, Melissa? On a Mission KC. I'm assuming that's Kansas City. I'm not sure, but On the Mission KC. Hopefully I didn't get that wrong. Scott Moore, Kate Growing in the Garden, and Amy Schumer. Fun fact, Amy Schumer lives in our neighborhood and we see her, and my wife was part of the Netflix show that she had. And so she helped coordinate the filming of her show on Netflix anyway. So they're both named Amy, and they run into each other once in a while. And my wife has no clue who celebrities are, but so it's hilarious to see them interact just randomly. Okay, thank you. These are great. Thank you for sharing those. Okay, so now that we have those kind of front and center in mind, you could have chose millions of different organizations and people and brands. You chose those 2 or 3. That's really powerful. So I'd like for you to think about this. Maybe even go to their Instagram account or Facebook account really quick and just kind of scroll through their content. Look at the pictures of the videos they use, the copy, or what they write as their captions and everything else. And I'd like for you to think about these 2 questions as you do that. Are they speaking to you as the biggest fan? And what do you enjoy or value about their content? And again, you can share this in the chat as well. Quite honestly, the reason I used to work in advertising when I first came to New York, and it was big, Super Bowl awareness campaigns. And social media is the antithesis of that, right? I love social media marketing because you're shifting over to just talking to the biggest fans of X brand, right? Like that's really powerful. You speak to them differently than you do the layperson who has no idea what the product is or its value. So if you have any that you'd like to share. Oh, Mary Atlantic White Shark Conservancy and Formula One. Nice. Oh, thank you, Kristen. Sorry, it's Dragon Boat Lifestyle. I mean, I have to look that up later. I don't know what that is, but I have to find out what that is. Or else I'll think about it all night. And so, does anyone have any thoughts on what they enjoy or value from the content? Why those two or three that you chose? What's something you value about their content? You can put that in the chat. Meredith said, yeah, I like it. I like it when I feel as though people are being authentic. We're going to talk about that a little bit. Kathy, I value that it's up to date. Janelle, same, up to date information. Kate talked about being behind the scenes from celebrities, advice for gardening in my area, very practical content. Kristen George Taki is very inclusive and has good basic human comments that apply across the board. Tips and tricks with TikTok, advocacy support from Janelle. From Betty, I value the information about updated information about retirement. These are great. Thank you. Thank you all. So I want to move into some of the tips for maintaining an authentic social media presence. So think about that, right? Like why you connected with those particular people, brands, influencers, whoever you chose, right? What is it about their content? I saw authenticity come up a lot, which is being yourself. So speak to your audience in your own voice. So whether you're funny, emotional, vulnerable, serious, or all of those emotions combined, use language and content that you would use during a dinner conversation and avoid creating a different persona. We can sniff that out so fast when someone's not being authentically themselves, right? It's so quick and easy to sniff out. And yet sometimes we button up a little bit when we start to put out a post, and perhaps it's not our real true thoughts, experiences, and ourselves. And we all do that, right? It's a scary place sometimes to put yourself out there publicly. So, but being yourself will always resonate with the community. Second is being a storyteller. Storytelling is absolutely king. So think about what you'd like to communicate and filter that through into a form of a story. I can't tell you how often I work with brands and some of the biggest companies, and we talk about storytelling and they're like, we got it. We hear about that all the time. We get it. We got it. And yet I'm like, I don't know if you quite get it. We try and be so comprehensive. So for instance, sometimes when we're posting about, say, MG, for instance, we can talk about, I was diagnosed this date, and then I went through this period and this period and this period. And you kind of go through up to today, covering years of experiences. Sorry, guys. And sorry, I'm on my own tonight. So thinking about like having just one particular story you can share, like one question, one answer, one prompt that's short and easy and easily digestible. For social, that makes sense. YouTube and some other platforms, more long form, it makes more sense to be more comprehensive, but being a storyteller and condensed. And then collaborative, being a strong voice of the community is important, but sometimes we try and be the singular voice of the community, and that's not how social works. You have to collaborate. So consider others within the community, whether it's MGFA or just anyone, or others that you've met in the actual community itself, that you can include, you can feature, you can highlight, or otherwise collaborate with in your content. Make it genuinely about awareness, the impact of the community, and not just about you. I talked to folks from different kind of autoimmune disease communities and things, and when they're like, Mike, I don't want to just, this makes me so uncomfortable to take my camera and film myself and be on camera for many reasons, right? And I just tell them, you know what, that's perfectly okay. Is there someone that you have a relationship with, and perhaps just highlight them? It's easier to tell someone else's story than our own in many ways. And so consider someone that you might even highlight on your own platform and kind of cross collaborate with. I'm just looking at some of the questions from Greg. I'm an adept storyteller, but face-to-face, not virtually. Where would I begin? Ooh, Greg, that's a great question. We could talk about that a lot. Can I just say this? What I've learned from my own personal experience is what I had just said. I would consider looking through content that you really resonate with, Humans of New York is kind of a good platform actually to look at. Go to Facebook and look up Humans of New York, and you can see kind of the storytelling they do. Most of it's written. They do video as well, but you can see kind of they jump right into a story. There's not an opening or a conclusion. They just jump into a story into someone else's world. So maybe start there and just kind of look, why is that so popular on social media? So thank you for the question. Okay. I want to point out Ron. So I'm sure some of you have seen Ron's content. I don't know how you don't love Ron. Meeting him, I met him and it was 10 seconds in. I'm like, this man is amazing. But I want to give an example of great storytelling on social media. So many of you might know Ron, like I said, he has recently published an ebook documenting his MG experiences. It's all compiled from stories that he posted on Facebook, and it was all put together. You can download that at mgfa.org. You can have it all right there. And a few things that I love about Ron's content is, number one, his humor. There's no question. That is genuinely Ron. Ron has decided to chronicle his journey with MG using humor because that's authentic to him. And he's a hilarious guy. He leans into humor, and it's become both a shield and his platform in many ways. Analogies. He uses lots of analogies to help explain concepts to people in relatable terms, and he pulls you into the content. And then he's telling his unique story. He's not telling others what to believe, what to think. He's just basing everything on his experience. And so Ron is joining us here on Zoom. So thank you, Ron.
Hello.
And Ron, I had a couple questions for you, and you can see some of his posts here. What made you kind of initially decide to share your MG story on Facebook?
I've always found that storytelling is a great way not only to share with others, but also in the case of my health issues, both this and some heart issues I had a couple of years ago, it's an opportunity for me to engage my friends, to engage them, not only for me talking to them, but them talking to me as well. To motivate them, to have them understand. And, I didn't set out to inspire people, but I get an awful lot of comments on my Facebook postings, including two today. I just got one come across from today's posting that says, you inspire me. And these aren't even people who have MG. These are people who have either other issues or no issues, because I've decided that I would rather laugh at this disease and fight it head on than to lay down and let it run over me. And so my stories are filled with silliness, which is kind of who I am anyway. And I take a simple situation, whether it's health related or non-health related, because I do both on my Facebook postings, and I just tell stories and have fun with it. Today's story, I started off saying I could tell everybody how miserable I am with MG, but I have a better deal to talk about today, and it was an echocardiogram I had yesterday. And so I spent my entire story on Facebook talking about all of the fun of an echocardiogram, including having the cold jelly rubbed on me and shoving this thing thing up into me to take my pictures and all that. And it was fun, and I think that's why I enjoy it. And by the way, I encourage all of you to please join me on Facebook. It says @RonFredman. I am a technological neophyte. I have no idea what @RonFredman is, but I'm sure it gets me somewhere. But you're welcome to welcome to do it at Facebook as well.
Yeah.
Maybe it's Facebook, I don't know.
Yeah, on the Facebook page, I think if you type in just your name,
cool.
Ron's name, he should be able to come up, and so follow Ron and his posts. Thank you, Ron.
You're welcome.
Can I ask, what has been the reaction from people that, just to be clear too, when you post, it's a mix. You have people from the MG community as well as just personal friends in life. So what has been the reaction from people that follow you on Facebook, on both inside and outside the community, I should say?
Positive, universally positive. People, first of all, they enjoy my sense of humor. I think they enjoy my honesty, because I'm talking about what's going on with me. I'm not embarrassed or ashamed or afraid. I don't know what the heck half the thing is that I'm talking about, but I can certainly talk how it feels and how it's impacting me. And so they appreciate and they enjoy. It makes them feel good. It makes them laugh. It makes them understand. I've had a lot of them say, we didn't know this thing existed. Heck, I didn't know it existed a year ago when it kind of smacked me up the side of the head. But now they are saying we understand and we appreciate what you're going through. That's been very helpful to me and to them. And one thing that I make sure I do, though sometimes I skip it, is if somebody is kind enough to make a comment to me, I make certain that I respond to them, whether it's a paragraph, a sentence, or just a smiley face, because this has given me the opportunity to engage in dialogue with people. Some I've known since we were children, some heck live in other countries. I would never know them otherwise. But here we are talking about something we share in common, whether it's myasthenia gravis or some silly story I wrote about a Boy Scout campout.
So you mix in your world, your personal life from with MG, but also just everything else that's going on in your life as well.
Yeah, the MG is part of my personal life. It is who this and some other issues. This is who I am.
Yeah.
Thank God I've been able to function fairly well in the world in this last year. I know there's a lot of folks out there who are struggling much more greatly than I am. So I'm able to have a fairly healthy, normal life, even though it's very difficult for me. And because of that, I am who I am and I am what I am, and I'm just happy to share it. Mike, you're muted.
Yeah, sorry, 1 second.
Your dog barking?
Ron, my last question. I have my
Yes.
help with the dog. What do you have in store for MG this month with Awareness Month?
Well, certainly I will continue to write stories. In fact, my next visit to the infusion center is on Thursday morning, where I get my dose of magic medicine. So I'll certainly be writing about that and all of the interesting people you meet along the way. But also this book that is on the Myasthenia Gravis Foundation website is really only captures the first quarter of my year. I'm just literally a week and a half or so away from my 1 year anniversary, at which point we'll drop the other 3 quarters on top of that, and you can join me on a full year's journey through this wonderful thing we call MG.
Wow, thank you. Thank you, Ron.
My pleasure.
Appreciate you. And if you have questions for Ron at the end, we'll have some time to bring Ron back and ask him any questions you'd like.
I'll be here all week, but if you're waiters, I am out of here.
I think someone called you Buddy Hackett incarnate.
I've been called worse, I assure you.
So our next section is about creating impactful comment. We talked about that, how to talk on social media, but that's just one piece of the puzzle. So we're going to jump into best practices to consider when you're creating the actual content itself. You kind of have your social voice. Now we're going to talk about the content. So a couple tips that I have are being focused, one story. I think I mentioned this earlier, but one story, one video, one focus. Avoid trying to be comprehensive or overload our information. There was a great comment made by someone, I think it was Mary. Thank you, Mary. Mary made a comment and said, I'll condense it just a little bit, but I was diagnosed 3 days before, admitted to ICU, and been in the hospital since March 19th. I didn't know how to really start, but when I could speak, I started to basically give updates, but want to share my true experience. I would just say this, when it comes to these topics, obviously share whatever's on your heart and whatever you'd like to share. But I found it when you can kind of hold their hand and walk them through the different stages of MG, or it's just a daily update, but you can say, think about one question. Like, for instance, I'm always interested to hear when you were first diagnosed with MG, what's the very first thing that you did? And then your story is that, and that's it. It just stops right there, right? And then another question could focus on another stage, right? But that helps to kind of make you step back and say, I don't always have to, I can keep a long-term relationship with the people that follow my content and listen to me. And so they understand what a daily life with this looks like. So trying to be bite-sized, we're going to talk a little bit about this, but audiences on social media are kind of goldfish memories, if you will. The attention spans are very short. So bite-sized nuggets of content perform best. In fact, if you're doing videos, less than 60 seconds is preferable. That sounds like it's not a lot of time, and it isn't a lot of time, but that kind of forces you to focus on one particular topic. The next is making it visual. Images really do matter. We'll talk a little bit about that in the next slide, but visual content is more likely to get shared than other forms of content. And then staying consistent. So giving yourself structure by committing to post X times a week, but never post for posting's sake. If you can post once a week, that's perfect. But I also want to say, when it becomes overwhelming, it's okay to take a pause, take a break from social. I tell people, when it becomes, if your mental health in any way starts to be affected, delete that app off your phone. Your content's still all there, and then reinstall that app when you're in a better place. Go to the next slide here. So short form or less than 1 minute videos have 2.5 times more engagement than long form videos. Let me read that again. Short form videos, meaning less than 60 seconds, have 2.5 more times engagement than long form videos. Another stat: 51% of users are more likely to share a video with friends and family over any other content type. So videos are key. And I know that might sound uncomfortable if you don't like being on camera or filming others, or maybe you don't have all the tools to engage. And so just know that it's always okay. Whatever puts you in a state where you can be open and vulnerable is more important than the highest quality, best iPhone that's out there. And I want to introduce someone else from the community that you might know, Deanna. Deanna's handle is resilience.is.beautiful. I want to give a shout out to Deanna and all that she does for spreading awareness of the community and what she does on social. So she uses various platforms. She's on Instagram, Facebook, YouTube. She also has a podcast too. I welcome you to check that out. Deanna is an amazing storyteller. She embraces being vulnerable in her posts, her vlogs. Another thing I love about Deanna is what Deanna is doing is just her content. It's visual, it uses videos, it's focused, it's consistent. It's all the things that we talk about. She's not posting every day, nor does she have to, but she's consistent in trying to keep people updated with at least 1 to 2 times per week. She's built this Resilience is Beautiful brand, and you can come to her channels to see more of her content. And she uses just a great mix of short-term videos like reels and stories on Instagram and Facebook, and longer forms saved for her YouTube vlogs as well. And so, Deanna, welcome. It's good to have you.
Hi, thanks. It's great to be here.
I have a couple questions for you, a little similar to the first question that I asked Ron, but what inspired you to put yourself out there on social media to discuss MG and life with a rare disease?
So when I was first diagnosed, I actually went through different job changes trying to stay in the workforce, still battling this disease. And then when it became to the point where managing it outweighed that percentage, I had to go and leave my career. And my career was very forward facing. It was very public. And when I disappeared, basically from the view of everyone, people stopped calling to ask me to do things. They stopped, emailing me, reaching out. And I was like, well, I can't really be mad at them if they don't know what's going on with me. I actually turned it back on myself, saying, I'm really mad at all these people that aren't reaching out, but I haven't told them what's happened. And so I had to go through this change of focus and say, if I want them to know and find out where I went, I've got to communicate. And social media was the place to do that.
Yeah. Thank you. Thank you. When did you decide to start posting under Resilience is Beautiful? You kind of shifted, right, from your kind of personal accounts to that. Can you
I
take us?
did. I went ahead and I was under my original name, and I decided that I wanted it to be a little bit different because I wanted to highlight and kind of focus on not just about me, but everything about my journey that it encompassed. And so it used to be Live to Inspire One, and I just really didn't feel good about that. And so I went on this journey, and resilience came to the forefront because resilience to me is an ever-going journey where I had this love-hate relationship with perseverance. but everyone talks about it in the past tense. And you can add ed to persevere, and it's something that is in the past. Whereas resilience, you can't add ed to the end of that and make it in the past form. You can talk about an experience in the past, but resilience is ongoing. It's ever changing. It's part of your journey. And I just fell in love with that. And no matter what that journey looked like, whether it was highs or lows or whatever, it's still beautiful because that's you. And no one can take that away from you.
I love that. Thank you for sharing that, Deanna. A common question that I'm asked is, what platform should I be on? There's so many out there. Do I be on all of them, from TikTok, Instagram, Facebook, Twitter? How do I make that decision? You have multiple platforms that you manage and really tailor content to each of the platforms. Can you take us through what your decision process for how you manage your channels?
Absolutely. So I've been on social media for quite a while, and I had to realize the people that were on the different platforms, why they were following me in the first place. I have another account that's called Magically Inspired Mouse. And then on my YouTube channel for RIB, or Resilience is Beautiful, I used to be a professional scuba diver. I used to be a shark diver. And so a lot of the people that follow me on that account want to know about my scuba diving experience and how can I do that being an MG patient, and what allowed the doctors to, and that's actually what I'm talking about coming into June, being a disability adaptive diver. And it's not for everyone that has our condition, but how did I get my doctors on board with that to get me back in the water, a part of myself that was lost? And so each one of those platforms, I have to really know who my audience is. And what Ron was talking about, you know who they are because you're talking to them. When they make a comment, when they interact with you, you interact back. So you get to know these people in this parasocial relationship. And so you know why they're there. And so Instagram is more of a different group of people that's on than what's on my Facebook. And there are a very different group of people that is on my YouTube channel. So catering that content is very important to me, that I make sure I give them why they're originally there, but continue my MG story throughout that entire segment.
That's perfect. Thank you. And sounds Shark, I don't even want to that just sounds terrifying. So you're much cooler than me. Do you have advice? What would you tell others about content creation, especially people who may not really know where to start?
The first part is just hitting the button. And that is the hardest. And someone mentioned that in the chats, and I really applaud them for being honest and vulnerable about that, because there are days where I don't want to hit that button. And I have to think about, why am I doing it? What's my purpose? What's my point? And here's a great example. I actually did something recently that I've never done before, because my community is so vast and different. There is a disability benefit for education. And a lot of people do not know that when you're awarded these benefits. I simply discussed education, and I knew that that was going to help somebody. But it got them back out into trying to make a new goal for themselves. And so if you look at all the different ways that these stories, your experience, and what Ron was saying, the entirety of your experience, not just going to the doctor or just doing the infusions, but all the different things, the mental health aspect of it, how it truly can impact every different group of individuals that are out there looking at us and saying, how is she able to keep going? It's not just about the disease, but it's about all the different aspects of our life.
Absolutely. Thank you, Deanna. And feel free, please follow Deanna on social, connect as a community if you haven't already.
Absolutely.
Yeah.
And then when you do hit that button and you do tell people about your story, make sure to reach out and tag these people. Ron was saying he didn't know what the @ symbol was, but there is a way to connect with us. And so when you do that, we want to share you as well. It is a community, and we're there to lift each other up. So when you hit the button, let us know.
Yeah, the magic @ symbol.
Yeah, that's right.
His name in, and you'll see, and it's a great way to, because sometimes you don't even know if someone's mentioned you or talked about you if it's not tagged in some way. And so that's
exactly.
So they can now reshare that content, and it spreads more awareness and it collaborates well. And so, yeah, perfect. Thanks. Thank you for that reminder. Well, thank you, Deanna. I'm going to move on to just the last part we're going to talk about tonight, which is engaging with others. Now that we've gotten people's attention on our social posts, how do we keep them engaged in a meaningful way? So I want to go over a couple tips that I have about that. So social can be antisocial in many ways. I love, Ron mentioned this earlier, but he tries to acknowledge every comment that's made on his posts. He reacts to people. That's a big deal. Anyone reaching out, especially when we're talking about MG specifically, like that is an opening up the dialogue. And I think that's how it should be viewed, is two-way dialogue versus just even responding. So taking the opportunity to not just even say thank you or you're welcome or acknowledging, and even maybe even taking it to the next level of starting a conversation with a question. Do you have any other questions that you'd like to ask about this? Or can I ask you what you're interested in this was? Just, is there a way you can pose a question to keep the platform social platforms? That's why they're there. The second is asking questions. So allowing your community to guide your content. So there's opportunities, as infrequent or frequent as you feel comfortable, where you can ask your community, meaning the people that follow you, questions, like using Instagram, an open-ended question, or perhaps even like a poll, and to understand what they'd like to learn more about, what they'd like to see more of, and use their feedback in the content you produce moving forward. Or just asking an open-ended question as your post itself and seeing how people react to that. And then it was mentioned right before, but connecting with others. So reaching out to other community members to find ways to creatively build awareness together. So like MGFA on awareness days and months, the creative assets that they have and spreading those across your channels, showing a uniform voice that can reach the highest level of awareness by keeping the community tight and connected. Right into a perfect caveat of MGFA. So to speak to the content that they are offering for Awareness Months or Awareness Month on social media, the graphics and the prompts, the MGFA team speaks to how community members can take action in June. And I wanted to invite Michael and Meredith on. Welcome, everyone. I'd like to just have you guys, if you could speak to some of the what you're doing for MG Awareness Month and some of the options that people have in the community to use your content. I'll turn it over to you.
Thank you so much, Mike. My name is Michael Antonellis. I'm the Vice President of Global Marketing and Communications for the MGFA. And we want to first thank Immunivant for partnering with us and bringing us onto this webinar. And I'd like to thank all of you out there who are already following the MGFA on various social platforms. We are on LinkedIn, Facebook, X, Instagram, and also YouTube. And so we have multiple platforms. And what we say around MG Awareness Month is that action drives MG awareness, and awareness creates action. And so when we're talking about awareness and building content and using social media, I mean, social media platforms are just such a great way of not only learning about MG and understanding the challenges and the storytelling, but also they're great platforms for sharing information, making sure that you're building your networks and being able to comment or engage with content from the MGFA and other MG groups. It's so important because when you're sharing content and you're engaging, you're actually creating these concentric circles of influence. You're building awareness simply by sharing an image or writing up your story and sharing your story. And so more and more we see so many people in the community taking the assets that we've created at the MGFA to make it very easy, taking an image, downloading it, and simply putting it on Facebook and sharing it out. We have our videos on YouTube. When you go to myasthenia.org, we have an awareness page with a number of different tools. We have a toolkit, we have social images, we have different types of content that you can share, and it's already ready-made. So if you want to just get started with social media, follow the MGFA or go to myasthenia.org, find those resources, and then simply start sharing that with your networks and family and friends. And that's how you get started. So that's a great way. We're just trying to make materials and content so much easier to share, so you don't have to go through a lot of work creating your own content all the time.
Perfect.
That's great. Both
Okay.
Mikes, thank you so much. Do you mind if I just chime in really quickly? Mike, you did an exemplary job of exactly what we're looking for in terms of engagement. For those who are not familiar, my name is Mea OConnor. I serve as Assistant Vice President of Patient Engagement, Advocacy, and Policy. I also happen to be living with MG as well. And I just wanted to echo what Mike said. And first off, let me just also thank our community members for participating in this as well. Ron and Deanna, they do such a great job of connecting with this community on so many different levels, and the authenticity that they bring by sharing their stories and being vulnerable and being willing to be vulnerable, I think is one thing. And then actually taking action in the way that they do is just so incredibly powerful. And I hope that through their stories and through their platforms, and through this program, you've been able to find some good tools and resources to take with you and run with it in terms of MG Awareness Month. You know, for us living with MG awareness is an everyday thing, right? But with June being the dedicated month, it's a great time to capitalize on this opportunity. And so I think that by engaging with us, whether, as Mike said, sharing a post, that is awareness, that is engagement right there. And it doesn't require much of you, and I think sometimes too that we don't always see the difference that it makes, but it makes a huge difference. Sharing, liking, sharing other people's content. And we love seeing that. And I think, for us, it just shows us, it also too is a great communication channel for us to understand this is the content you like to see. This is the content that matters to you. And so we're really trying to engage in more of that type of content. So please continue to share, continue to like, continue to create your own content. We love seeing people engage as this month in particular for June Awareness Month, but then, of course, throughout the entire year. And I think for me, I personally, I started my advocacy journey through social media and engaging in that way. And it takes a certain amount of courage to share your story. And I just encourage you to do so. I encourage you to share what you want to share and just feel confident in your voice. And we'll continue to help you amplify that voice. So I, again, just wanted to reiterate to engage with us during this month. We're so looking forward to it. We have so many good things in store, and I hope you take a look at the toolkit as well as all the other great things we have going on social media wise and on our website too. So thanks, everyone.
And Mike, one last comment. I would say to all the folks who are on this webinar now, we know what MG is, and all of us on this webinar know what MG is, but when it comes to awareness, we're trying to also reach beyond just the MG community. So we want people who don't even know what MG is to understand over time what are the challenges that patients and caregivers are facing when it comes to MG. What is myasthenia gravis and what treatments are out there? And so we're trying to drive even outside of the MG community, making sure that if, there are people out there who don't know what MG is, and we want them to understand what myasthenia gravis. So that's a big part of sharing. You're reaching those people and you may not even know it, which is so important.
Yeah. And there's no better person than, it's a friend. It's a friend from junior high, high school, college that now all of a sudden is very relevant if you're outside the community. What is MG? And now I hear this person that I know or I love or my friend, and you're going to listen and be interested. So thank you, Michael and Meredith, for your words. I'm going to close things out with a little bit of a curveball. And I'll go through this quick, but this is me and my grandma Eileen. My grandma Eileen, she passed away at 102 years old. Believe it or not, she's 98 years old here. It's just an example of engagement on social done well. I went with my grandma to Wendy's one day, and I took a picture of her by the Wendy's sign holding a Diet Coke, and I tweeted that out, and Wendy's responded. They retweeted that tweet, and she ended up becoming the face of Wendy's for several years before she passed away. So she would do live stream. This picture on the left of me and her is in the back of a Wendy's in Bellevue, Washington, where a crew from Wendy's flew out and they filmed a live Q&A on their Wendy's social media channels of her answering questions about life and, views on everything. And so it was this quite beautiful thing that they stepped in, and not only did they listen and acknowledge this little tweet of mine, but they jumped in, and someone who care less about social media, highlighting her was really impactful. And they're really famous for how they engage directly with audiences. Last thing I'll say is when she passed away, believe it or not, I was giving the eulogy at this small church, and Wendy's catered her funeral. So I smelled like chicken nuggets and Frosties and anyway, just the whole, and chili, like the whole church smelled like Wendy's. They had 10 employees come and bring and sponsor her funeral. So a fun little example of engaging directly with your audience. So some of my final tips, and I'll go through this rather quickly, but dealing with negativity. A comedian was on a talk show, and he had sold out Madison Square Garden for 3 nights total. And in this talk show, he was asked the question of, hey, when you, what's it like to stand in front of an audience with just a microphone and nothing else and hear 20,000 people laugh at your jokes? That has to be the most amazing feeling. And he said, well, there's no question. That's the job I chose. I love this life. But he's like, you know what I actually see amongst that 20,000 speckled in the Madison Square Garden? I see like 300 people that kind of have their arms folded and are kind of looking like, who's this guy? I didn't really get the joke. He's like, that's what I see. Okay, that's how we as humans live our lives in many ways. We can have 20,000, or I should say 19,000, what did I say, 300? 700 people that are positive and clapping and laughing and engaging with us. And yet we only notice that 300. That can be like social media, right? That one comment of 1,000 we can just focus on. And so that can deflate our confidence. And so dwelling in the negativity can harm us all. So when we have comments that I hope you don't experience a lot of negativity, but sometimes it happens. And I just have a couple of pieces of advice on this, is when you have someone that's either negative or perhaps it feels kind of weird to have on your page, like there's being upfront with someone. You can reply publicly to them if you want. You don't have to acknowledge every post, every comment like that. I recommend in many ways to acknowledge a comment and say, I'd love to chat with you more about this, and then take it into kind of your DMs and have the discussion there. So people publicly know that you're not just ignoring someone, but also you're having this conversation, and it puts the ball back on their court, if you will, that they now have to process what they've just said, and now they have to follow up with more information. So that's how I recommend dealing with some of the negativity that sometimes can dwell on social media. And then lastly, your mental health. We've talked about that a little bit, is more important than anything else. You're already dealing with enough in your life: kids, school, work, MG, everything, doctor's appointments, everything you have. It's okay to separate your personal account to an account solely focused on MG. If you decide, you can merge the two, kind of like what Ron does. But it's okay to take breaks. Take breaks whenever you feel overwhelmed. Delete the app for a moment, just step back. And that's okay. Your mental health is way more important than anything that we've talked about today. So we're almost out of time, but we have a little time to take some of the questions. And Kelly, with us.
Yeah, sounds good. So
Yeah.
I've been keeping track of some of the questions, and I think we've answered a lot of them, but maybe we can spend the last minute just answering one or two. First, there was someone that said that they have multiple pages for different businesses and interests. Do you recommend a separate page for MG awareness? How should we think about that?
Yeah, I mean, I might turn that over to Deanna and Ron to respond to, because they obviously handle those things a little bit differently. But Deanna, Ron, what are your thoughts on that?
Deanna, you're more the pro on it. I'm going to defer to you.
So I would see if what your purpose for breaking that away would be, because you have the opportunity to use hashtags. And I think of hashtags as a filing system, like a filing cabinet. And when you use those hashtags, you're able to click on them and say myasthenia gravis, MGFA. You can put all those on there and still filter that content and make that content show up in all of the myasthenia conversation. And if you're good with that, great. But if you really want to focus and get the community to see just that page, you can put MG in your actual handle, and that makes it stand out. So again, if you are juggling separate things, one, is it obtainable? Is it a good goal for you? Or is it putting too much work on you? And also, does it necessarily need to be separate from your own personal life? And you just have to answer those questions for yourself.
Thank
If she
you.
said it right.
And Mary, Mary,
Go
had
ahead.
a,
Hashtag
Yeah, I was
she's
just
right.
gonna say. Go for it.
Mary just had a question about suggested hashtags. Are there a couple that you should definitely use, Deanna? I know there's a long list, but there's some that you should definitely recommend people use.
For MG.
So
For MG.
going for Michael's point as well, I actually use a very vast array of hashtags during June specifically, particularly for the rare disease community. I use rare disease a lot. I use specifically neuromuscular. I use, what was the other one I used? And it wasn't a big one, but antibody positive or something like that. It was something funny. Infusion life, I have a port, so I have port life on there. So it reaches all these different people that are actually experiencing very similar medical journeys, but your diagnosis, just like our snowflake, we're all different. And so it gets everybody into that conversation just by using those different hashtags.
And you know, a couple of other hashtags we've used, certainly myasthenia gravis, that is one, and MG, but also MG Strong. MG Strong is a real popular one during the June timeframe.
Great. There's, maybe we'll just, one more question. This is more of a comment, but someone had said that questions, when you're posing questions to your community, they're for generating engagement, give your community a chance to share their stories. Any input on that? Any comments from you, Paul, about interacting and asking your community members questions to generate their story sharing?
Well, I belong to an MG community. It's a Facebook group called Myasthenia Gravis Friends. That's actually how I got involved with a lot of the people I'd met around the world. And some of them are happy to share their stories. Some of them share questions. And then others of us will try to answer, not necessarily from a medical perspective, but from an experiential perspective. So I find that very important. But, you know, to me, it's real simple. If somebody feels comfortable enough sharing their story, either directly by writing it out or videoing it out, or linking onto someone else's story and then making comments about it, it's an effective way to get your feet wet and get into it. Because candidly, putting your face and your writing and your emotions on social media can be kind of scary and intimidating. So the first thing I would suggest is don't let it bother you. You are among friends. You are here to tell your story, and you're not going to be graded. You're going to be appreciated. You're going to be talked with. You're going to be helped. You're going to be supported. But nobody's going to say you missed a comment. If you did, you tell them you use a different style book.
Well said, Ron. I just wanted to add to that too. I think from a question standpoint, I know for me, it's like, I encourage people to ask questions they want answers to, right? Like, ask questions that you're actually curious about. Don't just ask questions to fulfill some sort of engagement or, you know, get certain, you know, if you think if that's going to be popular, ask the questions you want to know about and to generate a dialogue that you're passionate about. So I always like to do that because I think that just stirs up conversation. And also it's an educational opportunity. It's an educational opportunity. It's an awareness opportunity. And it's an advocacy tool. So, you know, it's a triple threat when you're asking questions you care about.
Absolutely.
But
Well,
be sure to
thank
ask
you.
open-ended questions that cannot be answered with yes, no, or I don't know.
Yes,
Good
very,
point.
very good point. Well, thank you everyone for taking the time with us today. I know we're a few minutes past the hour. We appreciate you sticking on with us. We appreciate you, Ron, and Deanna, and Meredith and Michael from the MGFA. Please go to meaocedia.org and follow them. Look at the toolkit for all of the resources. Download Ron's ebook. And there's lots of ways to get involved for the month of June. And then just lastly, if you go to the next slide, Mike, we just want to thank all of you for participating tonight. You know, we love doing these AIM programs, and we want to continue to do more that are useful to all of you. So if you have a minute and can take 2 or 3 minutes, click on the QR code, go take our quick survey and let us know how we did and what you'd like to see more of, and where we can continue to improve. We appreciate all of you, and thanks. Have a great rest of your evening.
Thank you all.
Thanks, everyone.
Bye. Thank you.
Bye-bye.
Bye now.